Preventing brain damage involves various lifestyle choices and practices. Here's an extensive list of strategies. 1. Protective gear. Use helmets during sports like cycling, skating, or contact sports to prevent head injuries. 2. Seatbelts. Always wear a seatbelt in a car to prevent head injuries in accidents. 3. Avoid toxins. Stay away from substances like lead, mercury, and other neurotoxins that can damage the brain. 4. Healthy diet. Eat a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats to support brain health. 5. Regular exercise. Engage in regular physical activity to improve blood flow to the brain and reduce the risk of cognitive decline. 6. Mental stimulation. Stay mentally active by reading, solving puzzles, learning new skills, or engaging in other intellectually stimulating activities. 7. Quality sleep. Get enough sleep to support brain function and repair. 8. Stress management. Practice stress-reducing techniques like meditation, yoga, or deep breathing to protect the brain from the harmful effects of chronic stress. 9. Social interaction. Stay socially connected to reduce the risk of cognitive decline and depression. 10. Brain exercises. Practice activities that challenge your brain, such as puzzles, memory games, or learning a new language. 11. Manage chronic conditions. Control conditions like diabetes, high blood pressure, and high cholesterol to reduce the risk of stroke and brain damage. 12. Limit alcohol. Drink alcohol in moderation, as excessive alcohol consumption can damage brain cells. 13. Avoid smoking. Smoking can lead to brain damage due to reduced blood flow and oxygen delivery to the brain. 14. Head injury prevention. Be cautious to avoid falls and other accidents that can cause head injuries. 15. Regular checkups. Schedule regular checkups with your healthcare provider to monitor and manage any health conditions that could affect your brain health. 16. Maintain a healthy weight. Obesity can increase the risk of conditions like stroke, which can lead to brain damage. 17. Avoiding drug abuse. Avoid illicit drugs and misuse of prescription medications, as they can harm brain function. 18. Hydration. Drink plenty of water to support overall brain health. 19. Sun protection. Protect your head and skin from excessive sun exposure to reduce the risk of skin cancer that can spread to the brain. 20. Avoiding pesticides. Minimize exposure to pesticides and other environmental toxins that can harm the brain. 21. Regular health screenings. Regularly screen for conditions like brain tumors, which can cause brain damage if not detected and treated early. 22. Limiting exposure to radiation. Minimize exposure to radiation from sources like X-rays and CT scans unless absolutely necessary. 23. Healthy pregnancy. Maintain a healthy lifestyle during pregnancy to reduce the risk of developmental issues that can lead to brain damage in the fetus. 24. Safe driving. Follow traffic rules and drive defensively to reduce the risk of accidents that can cause brain damage. 25. Follow safety guidelines. Follow safety guidelines at work and home to prevent accidents that can lead to brain injuries. 26. Cognitive rehabilitation. If you have experienced a brain injury, consider cognitive rehabilitation to improve cognitive function and quality of life. 27. Limiting screen time. Limit screen time and take breaks to reduce the risk of digital eye strain and other potential effects on brain health. 28. Environmental safety. Ensure your home and work environments are safe to prevent accidents that can lead to brain damage. 29. Use of protective headgear. Use protective headgear when engaging in activities that pose a risk of head injury, such as biking, skating, or skiing. 30. Avoiding heavy metals. Minimize exposure to heavy metals like lead and mercury, which can damage the brain. 31. Eating fish. Consuming fish rich in omega-3 fatty acids can support brain health. 32. Regular dental care. Practice good oral hygiene and visit your dentist regularly to reduce the risk of infections that can affect the brain. 33. Regular eye exams. Get regular eye exams to detect and correct vision problems that can affect brain function. 34. Avoiding overuse of medications. Avoid overusing medications, especially those that can affect brain function, without consulting a healthcare professional. 35. Stay informed. Stay informed about the latest research and recommendations for brain health to make informed decisions. 36. Genetic counseling. Consider genetic counseling if you have a family history of neurological disorders to understand your risk and take preventive measures. 37. Avoiding extreme temperatures. Avoid exposure to extreme temperatures, as they can affect brain function. 38. Avoiding excessive noise. Limit exposure to loud noises to prevent damage to the auditory system, which can impact brain health. 39. Protecting against infections. Take steps to prevent infections, as some infections can affect the brain if they spread to the central nervous system. 40. Proper medication use. Use medications as prescribed and follow instructions carefully to avoid adverse effects on brain function. 41. Proper posture. Maintain good posture to reduce the risk of neck and back problems that can affect brain function. 42. Use of protective gear in sports. Use appropriate protective gear, such as helmets and padding, when participating in sports to prevent head injuries. 43. Avoiding electrolyte imbalance. Maintain proper electrolyte balance by staying hydrated and eating a balanced diet to support brain function. 44. Avoiding environmental toxins. Minimize exposure to environmental toxins, such as air pollution and pesticides, which can harm the brain. 45. Regular blood pressure checks. Monitor your blood pressure regularly and take steps to keep it within a healthy range to reduce the risk of stroke and brain damage. 46. Limiting sugar intake. Reduce your intake of sugary foods and beverages, as excessive sugar consumption can negatively impact brain health. 47. Limiting caffeine. Limit your caffeine intake, as excessive consumption can lead to negative effects on brain function. 48. Limiting alcohol and drug use. Avoid excessive alcohol consumption and drug use, as they can damage brain cells. 49. Maintaining a healthy lifestyle. Adopt a healthy lifestyle that includes regular exercise, a balanced diet, and adequate sleep to support brain health. 50. Seeking medical attention. Seek medical attention if you experience any symptoms of brain damage, such as headaches, memory loss, or changes in behavior. These strategies can help reduce the risk of brain damage and promote overall brain health. It's important to consult with healthcare professionals for personalized advice and recommendations. Like, share, subscribe for more videos.